It is so easy to take your hands for granted, the feeling of hot and cold, grasping something quickly with your fingertips.
But a New Jersey woman deprived of those experiences for years is getting a second chance, and she is making history. CBS 2's Dana Tyler has the story.
Sheila Advento is the picture of independence, putting on her makeup, sending an email, simple everyday things the 33-year-old doesn't take for granted.
Can I shake your hand? Oh, I feel it. Strong, strong, strong. Good. Yep. Am I hurting you?
Nope. I can feel the pressure, more so than the external feeling for now.
These are not the hands she was born with. The Hackensack resident is the first woman in the U.S. to undergo a double hand transplant.
I'm completely, positively overwhelmed by it.
In what way?
I guess just that the fact that I'm part of history.
Advento's normal life took a shocking turn 7 years ago. The 27-year-old contracted a severe bacterial infection called meningococcemia and fell into a coma. Her mother, a hospital nurse, made the only decision she could to save her daughter's life. She gave the okay for doctors to amputate her arms and legs.
I remember Sheila telling me, "Mommy, don't cry. There is a reason for this." I mean, boy, she had the strength to tell me that, you know?
Where's that come from?
I don't know. It's just there. I mean, why else would it happen to me?
But after it happened, the quadruple amputee was determined not to be dependent or depressed. She worked hard adjusting to her prosthetic limbs. As part of her healing, she wrote a book sharing her story.
I had a year of recuperation.
She also offers encouraging words to amputee support groups.
I believe that's my true calling, just to share my story.
Her positive attitude was key as she faced challenges. Her artificial arms were cumbersome, and with no fingers, she had no sense of touch. A hand transplant was always in the back of her mind.
If I prayed for it, to get the hands, I felt guilty because it was someone else's life, and someone else is going to give those hands to me, so it was more like I just had to be patient.
Last fall, Advento was accepted on the transplant waiting list at the University of Pittsburgh Medical Center. The hospital studying anti-rejection drugs had already done 4 successful hand transplants. Beyond screening for blood and tissue types, Advento's new hands had to be the right skin color, size, and age.
The most important part is assuring that a patient is mentally competent to accept such a big operation and a big responsibility, because it's a lifelong commitment.
I wasn't scared at all. I was focused.
In mid-September, in a 12-hour surgery, a surgical team of 20 people attached the nerves, tendons, and blood vessels of 2 new hands. Within hours, success. For the next 4 months, Advento lived in Pittsburgh as her occupational therapy increased to 6 hours a day, 5 days a week.
Bring your thumb down.
Her doctors and therapists say she's made remarkable progress.
Her long flexors, where they connected the hand onto the arm, they're real tight, so it's real hard for her to fully get her hands straight unless I bend her wrist. So we do a lot of stretching.
My brain still has to get readjusted to the fact that 7 years later I have hands, so it's readjusting to the motion of it. Right? But it's getting there.
It's repetitive work. She's relearning how to pull out a plug, lock a door, or getting back to her hobbies of weaving and drawing. But it's with renewed appreciation for life's simplest pleasures, talking with her hands.
Now I can even express it more.
That's the way you normally are, right?
Yeah, that's me.
That's her. As you can see, Sheila Advento has an incredible spirit. You also saw she can't move all of her fingers yet, but every day there's progress. In fact, before she was right-handed, but her new left hand is stronger right now. She's back home in New Jersey, back at occupational therapy again, eager to live independently once again, get back to work, and you know what? She can't wait to get a manicure.
Oh.
Maurice and Christine.
That's just unbelievable.
It is, isn't it?
What's the long-term prognosis here? She's got such a great attitude.
She
You
really
figure
does.
That's where it all starts, right?
She really does. And at the University of Pittsburgh Medical Center, all the other hand transplant patients are doing well, all successful. hospital. And so she does have to worry about anti-rejection, but no problem so far. But that is part of what this study is, you know. She's grateful to the family, whom she doesn't know, and so thankful to her family for, imagine all these years, for their encouragement and their support.
Really cool.
She's a really cool person, isn't she?
Kidding.
She really is.
I love the talking with the hands.
Yeah, right?
That's great.
Such courage and really such inspiration too for the rest of us.
That's,
Dana, thank you.
You're so welcome.
You bet.